I'll be your nurse today.
Hi.
So I heard you're in for like headache and nausea, blurry vision a little bit.
Yep.
Yeah. So can I just start by what's your name, date of birth?
My name is Jillian Maitland. I was born on November 24th, 2000.
All right, perfect. So I'm just gonna start with some questions for you.
Sure.
So first, are you on any medications?
Yeah, I take 100 milligrams of Zoloft every night.
Okay. And do you have a history of head injury, spinal cord injury, or stroke?
No.
Okay. And do you currently or have you ever smoked cigarettes?
No.
Do you have a family history of high blood pressure, stroke, Alzheimer's disease, epilepsy, brain cancer, any degenerative diseases?
No.
No? Do you ever have exposure to lead, insecticides, pollutants, or chemicals?
No.
None of them.
None.
Do you ever have difficulty understanding what people are saying to you or talking to others?
No.
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 Do your symptoms tend to interfere with your daily life?
No.
Not usually.
Yeah, not usually.
Okay, so like what are your typical eating patterns?
Usually I have about a solid meal a day, just one, and then
Mhm.
I'll just snack on like fruits and vegetables throughout the day, some carbs and stuff.
Okay, so like healthy stuff, but just not like full
Yeah,
meals.
yeah.
Okay. And do you drink caffeine or alcoholic beverages?
Drink coffee,
Okay, so like 1-2 cups a day.
just a cup a day in the morning.
You
Usually,
use
just
cream,
about.
sugar?
Yeah, just cream.
Okay, perfect. And are you currently under like excessive stress right now?
I have a few exams coming up, so like yeah.
School stress there?
Yeah.
And what do you do to like relieve it? Anything?
I like to take naps usually, or I'll go for a walk around campus.
Okay, that sounds good. So do you exercise regularly?
No, just walking.
That's good. That's exercise. Do you ever experience weakness or incoordination?
No.
No? Okay, perfect. So we're gonna move on to talk about like your actual headaches now.
Yeah.
So when you have it, like what does the pain feel like?
My head throbs.
Just a throbbing
Yeah, and
pain.
it burns a little bit too.
Okay. And when did you start getting the headaches?
Like about a week ago.
Okay. And is it a consistent headache for a week or does it like come and go?
It comes and goes.
Comes and goes.
Yeah.
Where exactly are you feeling the pain?
Just like here.
Just right up there?
Yeah.
All right. And on a scale of 1 to 10,
Like a 6.
a 6-ish?
Yeah.
Is there anything that makes it better or worse in the moment?
I like to take ibuprofen a little bit.
Does that help?
Yeah, sometimes water helps.
Okay. And do you have any other like symptoms that occur during it?
I get nauseous a little bit.
A little bit of
Yeah, a little bit of
vision
blurry
over?
vision, yeah.
Okay. And does that happen every time you get the headache or just like
Just occasionally.
Okay.
Not too often, but like it does happen frequently, I guess.
So now we're gonna start her assessment. So we'll take her vital signs here, a full set of vital signs, and then I'm gonna make sure that you are alert and oriented. So do you remember your name?
Jillian.
Good. And do you know where you're at?
Cincinnati.
Good. And do you know today's date?
It's November 21st.
Good. So now I'm gonna start by looking at her hair and her scalp. Looks like there's no dryness, no flakiness. The hair is even and full throughout. And down to the ears, looks like you have a bunch of piercings. They all healed well.
Yep.
No infections.
No.
Okay, looks like you have 5 on your left ear and 6 piercings on your right. And for your neck, no lesions, no nodules. Is there any tenderness?
No.
Okay. And trachea is midline. Now I'm gonna look at your eyes. So I'm gonna have you just look straight past me and I'm gonna shine the light in your eye. Good. Strict on both sides, and now I'm just gonna have you look at the pen. I'm gonna bring it in towards your nose and just keep staring at it. And she accommodated, good. Now I'm gonna check your fields of gaze, so just keep following the pen. Good. And good, okay. Now I'm gonna go down to your nose. Can you close one side and blow out the other? And do the same thing. Good, both sides are patent. Looks like you have a nose ring. Is that healed well?
Yeah.
Good, okay. Let's look in your mouth. Can you open your mouth, say ah? Good, I'm just gonna look in real quick. Looks like everything is pink. There's no lesions. Teeth are clean. And tongue looks good as well. And can you please smile? The face is symmetrical, good. And can you raise your eyebrows? And poof out your cheeks. Good. Now I'm gonna check your carotid pulses. Good. Equal and bounding on both sides. And now we're gonna go into your cardiac assessment here. Okay, so I'm first listening for bruits. Okay, and now I'm going down to the sternum and I'm locating the first rib and then the second intercostal space, which is the aorta. No murmurs or dysrhythmias heard. Now I'm going over to the other side, second intercostal space for her pulmonary valve. No dysrhythmias or anything heard here. I'm going down to the third intercostal space to Erb's point. Sounds good. And then down one more space to tricuspid. Sorry.
No, it's okay.
And then if I just have you lift your breast, please. We're gonna go listen to mitral over here. Good. If I just have you lift it one more time, I'm gonna check your pulse, your apical pulse, and count for it for 30 seconds. Good. And can you just put your arms out for me? I'm testing for moisture and temperature. Looking at your fingernails, they're groomed, pink, capillary refill in less than 2 seconds. Looks like there's no edema. Can you please squeeze my fingers? And can you push on my hands? Okay, so now I'm gonna start with your abdomen. Looks like it's flat, no lesions, no nodules, nothing like that. I'm just gonna go ahead and take a quick listen. Sorry. Okay. Vowel sounds in all 4 quadrants. I'm just gonna palpate it really quick. Is there any tenderness when I do this?
No.
Nothing. Okay, I'm just gonna check your radial pulses really quick. Equal on both sides. And I'm gonna come down here to your feet. I'm gonna have you push against my hands with your feet so you can bend them. Push. Good job. And now can you bring this foot to that knee and do the same thing on the other side for me? And then I'm gonna have you open and close your arms like this for me. Good. And then you're gonna go like this for me. Good job. I'm checking your legs for moisture and temperature. No lesions, no nodules, hair shaved. I'm gonna check your capillary refill, so I'm just gonna squeeze your toes. Okay, it's in less than 2 seconds. And okay, and I'm gonna check your pulses here. Good. I'm just gonna go right behind your leg here. Okay. Now I'm gonna listen to your lungs here on the front and back. So you can just, I'll have you take a few deep breaths here. Deep breath for me. Good. Okay. Good. Couple more on the front for me. Thank you. One more time. And last one for the front. Good. Now I'll have you turn around. I'm going to listen to your lungs from the back. Starting at C7. Okay. Good. Deep breath. Good job. Last 2 for me. Thank you. Alright, good. Now we're going to just check your gait real quick, which is just how you walk. So I'll just have you walk a few steps forward for me. And then you can turn around, and I'm going to have you tandem walk, which is heel to toe back to me. Just heel to toe. Good job. Thank you, patient.